Have you ever thought, why do I keep eating when I'm not even hungry?
Or maybe you're just overwhelmed by all the diets and wellness trends. It's chaotic out there. Hello, I'm Dr. Yan.
Hi, I'm Zoe, and welcome to Ask the Binge Eating Expert, the podcast where we get real about binge eating and healing your relationship with food.
We're the co-founders of ARCare, the #1 science-backed app helping people stop binge eating. We cut through the noise and tackle the real roadblocks to recovery without shame, without judgments. You know how people say the best time to plant a tree was 20 years ago? The second best time is now?
Yes, it's along the line of you don't have to see the whole staircase, just take the first step.
Exactly. Sometimes we wait until the very last minute to tackle things, especially when it's tough or scary.
Totally, but when it comes to health, I think it's usually much better to take immediate action rather than letting things get bigger or more serious.
I know, but I think there are still a lot of people wondering when it's actually the right time to get help for binge eating.
Yeah, how do you know when it's serious enough to reach out?
Exactly. It's tricky because binge eating can feel so private and confusing. Some people think they just need to try harder or wait until it gets worse.
Or they might feel embarrassed or ashamed, so they avoid talking about it at all.
Totally. But I've seen folks say that getting help early made a huge difference. It's like catching a problem before it snowballs.
That makes sense. But sometimes it's hard to admit that you need help, especially if you don't meet some kind of a threshold in your head.
For sure. And binge eating doesn't always look the same for everyone. It could be occasional, but still harmful.
Agree. But the longer it goes untreated, I think the harder it can be to manage, not just physically, but emotionally.
So maybe the right time to get help is actually now, or as soon as you notice it's affecting your life.
Maybe. And it doesn't mean jumping into something huge all at once. I think small steps count, like talking to someone you trust.
Ready to see what questions are coming in today?
Yes, let's dive in.
I'm Rowan, 29, working night shifts as a nurse and living with a roommate who shares a fridge with me. I don't binge very often, maybe about once a week, sometimes more on my period. When it happens, it's quick and secretive, and I usually end up feeling really ashamed. Afterward, I try to hide how much I ate, which isn't always easy since we share the fridge. Some days, binge eating feels like just part of how I eat, nothing too serious. But other days, I wonder if it's actually a mental health issue. Overall, I'm not sure if it's bad enough to get help. I haven't had a crisis or anything, but the binges and hiding them definitely take up a lot of mental energy. With my busy schedule and limited resources, I also wonder if it's even worth trying to tackle it right now. When is the right time to seek help? And are there long-term risks if I don't?
Rowan, thank you for putting this into words. There's something so thoughtful about how you're holding it. Not minimizing, not dramatizing, just honestly naming what it is.
Yes, and you're not just talking about the binges themselves, but the rituals around them, the hiding, the shared fridge. It's clear you've been paying attention to yourself, even in the middle of the really busy life.
What really struck me is how you said some days it feels like nothing, and other days you wonder if it's a mental health issue. That ambivalence, I think a lot of people can relate. It's a quiet kind of distress, not a crisis, but still costly.
Totally. The kind of thing that doesn't always look serious from the outside, but still takes up some considerable space in your head. I know we're about to bring in Dr. Katherine to talk more about what to do in these middle ground situations. But before that, I just want to say reaching out for help now doesn't mean you're labeling yourself or locking into this diagnosis. It just means you're choosing not to ignore something that's quietly asking for your care.
Exactly. Getting support doesn't have to mean a 10-step plan or a total life overhaul. It can be one conversation, one small shift, one gentle breath of relief.
Definitely. Let's bring in Dr. Katherine, a medical doctor who specializes in eating disorders. I'm really curious to hear what she'll say about how to know when it's time to seek support and what we risk if we keep waiting. Hey, Catherine. Today's letter is from a person who is unsure whether to get the professional help or not about her binge eating. So, when is the right time to get help? Are there certain points when treatment is more likely to lead to successful results than the others?
Say if this is something that's actively bothering someone that they think about a lot and it's impacting their life, then it's never too early to get treatment, even if it's maybe once a week or twice a week, as is the case with this person. So it's never too early to seek out some sort of help. And I think this is where our care really fits in nicely. This could be a nice, easy, confidential way for somebody to seek treatment, but maybe they're not having to take off from work to be able to go see their clinicians. So we do know that early intervention for eating disorders is most impactful. If you are struggling, the earlier the better to maximize your chances of recovering and getting over it. With that said, it's also possible if this has been something you've been struggling with for many, many years to still reach recovery as well. So I want to call that out.
Do you think binge eating occasionally once a week, is that still something to be concerned about if they're binge eating once a week? Or can that fall within a quote unquote normal range where it's just, it's not ideal, but it's also part of life?
For somebody who's binging once a week, I would say it matters more how distressed they are. If this is somebody who maybe they lose control and they eat a large amount once a week and there's no consequences and they wake up the next day and they're feeling good and they're not feeling guilty and they're not feeling shame, then I think that's perfectly fine. In fact, this is a normal pattern that a lot of us do follow from time to time, right? So for me, the differentiator is the amount of distress, if there's shame, if there's guilt, if somebody is actively thinking about the binge episodes and feeling tremendously guilty when these episodes occur. That's the difference. That's the second person is the one I would say, I really think you should seek treatment for this because it is impacting your life and it's impacting how you feel about yourself. And that's never a good thing.
Can occasional binge eating, let's say binge eating once a week, be okay, or does it can still impact health over time, even if it doesn't really escalate into the full-blown binge eating?
I think it would be unlikely for a one time a week binge episode to significantly impact somebody's physical health. I think our bodies can withstand some fluctuations in our intake. And if we're talking once a week, then I think that's unlikely to cause long-term effects to somebody's physical health. If it gets to be more frequent, and again, if that shame or guilt component is creeping in, then it probably is a bigger problem that may need to be addressed. We do know that there are some people who decide to seek treatment for binge eating disorder because they've started to have medical complications, whether it's premature diabetes or maybe some liver inflammation, things like that. So there are many reasons why somebody might seek treatment for binge eating disorder. And sometimes it's a physical health issue. Sometimes it is a mental health concern, like feeling tremendously guilty after a binge eating episode. But whatever brings you to seek treatment, hopefully that will be the motivation to kind of keep with it and know that recovery is possible.
About Rowan, do you think her binge eating could be connected to working night shifts or disrupted sleep patterns? Is that a factor that you've seen triggers binge eating often?
Absolutely. Disrupted sleep, especially if somebody is doing an opposite sleep wake cycle like a night shift nurse, we know absolutely can lead to increased binge eating episodes. I remember when I was doing my medical training, you just feel a need to eat even when you may not physiologically need to eat. We know that there are certain hormones that are being produced that make it more likely for virtually every person to binge eat when they have a disrupted sleep-wake cycle. So if Rowan is struggling with this, what I would say to her is that, this probably isn't your fault. There's chemicals going through your brain and body through a night shift that do make you more prone to being less likely to regulate your intake. Plus, you're probably really tired, and there's lots of factors at play here.
Is it common for people to binge more around their menstrual cycle?
Yes. So I think many women have experienced increase in hunger, an increase in binge eating, or a decrease in the ability to kind of regulate food intake, particularly around that time of the month when somebody's about to have a menstrual cycle or during a menstrual cycle. And we know that hormone fluctuations can be a trigger and often are for many people. So that is not unusual. And it's something just to be aware of so you can track and see, oh, yeah, it seems like these episodes are occurring most commonly right before my period. If that's true, then give yourself some grace because there's probably some hormones at play.
In these instances where it seems like Rowan occasionally binge eats and it seems to be very impacted by her working night shifts and her menstrual cycle and less from her previous experience of restriction or specific emotional triggers. In these cases, what kind of strategies would you recommend?
If somebody is noticing a significant escalation in binge eating episodes around the time of their period, it might be helpful to try a hormonal contraception device, maybe like an IUD or a birth control pill, because we know that those medications can help stabilize and regulate hormones a little better. So that might be a case if somebody is noticing every month right before my period, I binge eat and I feel horrible about myself. That might be, in my mind, a reason to try something to sort of level out the hormones and kind of keep them more consistent throughout the month. For somebody who's working night shifts, it is tough to prevent binge eating episodes because, again, your biological hormones and your circadian rhythms are all working against you. And do tell you, gosh, you need to make it through this night. You need to eat, right? If it's somebody it's a once a week thing, it may not be a big deal. If it's somebody who, gosh, every single night they go to work and they're binging and they're feeling guilty, in that case, I might look at and see, is night shift really the best time for me to be working? It might be best to figure out a day job or an alternative solution so that that person can really optimize their sleep wake cycle, because some people are going to be very sensitive to a reverse sleep wake cycle and others maybe less so. So in Rowan's case, if this is something that's happening and it's bothering her, I might advise her to look into a day shift. Could there be a better shift for her so that she's not struggling with this as a direct result of the night shift?
Got you. Yeah, I guess in this case, triggers are relatively obvious, so maybe it's best to address those first. Earlier, you mentioned that early intervention is always the most impactful, and you mentioned that in the prior episodes as well. Is the treatment plan when you're having an early intervention different from a treatment plan when the eating disorder is progressed a lot, or they are pretty much the same, but it's just more impactful when it's done earlier?
As I discussed previously, early intervention is more impactful. So the earlier you can get treatment for an eating disorder, the more likely you are to have success and to go on and achieve full recovery more quickly. I work with a lot of children and adolescents and young adults who their eating disorder has only been going on a short while, and they can often reach full recovery fairly quickly. I mean, it still takes some time. It takes a lot of work, a lot of dedication. But sometimes within 6 to 12 months, they're kind of back to where they were. Whereas somebody who's maybe a bit older and has been struggling with something for years, it's going to take longer. And our goals of treatment might look a little different. Instead of saying for a 14-year-old who's had an eating disorder for 3 months, hey, I want you to be fully weight restored and doing everything you want to do in 3 to 6 months with no further complications of this and essentially in remission from your eating disorder. For an adult who's been struggling for years and sometimes decades, I might take a harm reduction approach. This week, I want you to reduce your binge eating by 10%. It might be a little bit less dramatic in terms of the progress you can make, and that's okay. If it's 10% this week, and then in 3 months we do another 10%, then eventually you might get where you want to be.
So the treatment itself might be similar, but the expectations and the goals of treatment might differ depending on how far along.
Exactly right. Yeah.
I think someone like Rowan might wonder, how can she approach this occasional issue that she has without making it feel like a big deal, without having to, for example, say I have binge eating disorder, like a very serious thing, while still taking it seriously enough to take care of herself.
I think there's a lot of people out there who maybe don't meet the full criteria for an eating disorder diagnosis or a binge eating disorder diagnosis, but they do have what I would call a subclinical eating disorder, where they do have some symptoms here or there. They're bothersome, but not enough to severely impact their lives. The Our Care app is really a great opportunity for somebody like this to maybe nip this in the bud and get to the place where binge eating is no longer something that is even occurring at all or very minimally occurring. I also want to normalize that as part of living in our society. I think a lot of us do once a week eat larger than ideal amounts, and that's okay. I don't think once a week is going to negatively impact your long-term physical or emotional health. So I also would say to Rowan, give yourself a little bit of grace, because this is also not that unusual in the grand scheme of things. It becomes an issue if it's happening more regularly or you're feeling really badly about it.
Thanks for joining us. Make sure to subscribe to the Ask the Binge Eating Expert podcast so you never miss an episode. Have a question you want us to answer? Email us at askthebingeeatingexpert@gmail.com.
Please note, the advice provided on this podcast is not a substitute for professional treatment, therapy, or clinical care. If you're looking for additional support or want to take action on your own terms, check out the Our Care app, the #1 science-backed app for overcoming binge eating.